all these techniques, right? Some of them might have not gotten even a chance to do a slit lamp, or they might have not had a chance to do a lensometer. So keeping in mind your exposure, and also the last past 2 years, most of you would have been in a COVID phase, right? So I'm not sure how many of you have got an exposure to have a good practicals at your respective colleges. Okay, because most of them have got a virtual sessions, okay, because of the COVID restrictions. So this is what is the syllabus which we are going to cover it only for a month duration. This is not the syllabus for your internship. Okay, so don't think that only these things you are going to learn it. These are the modules which you learn it for the first 1 month of your internship. You have got the next 12 months where you are going to learn the complete subspecialty training and other examination techniques which are required for the comprehensive examination. Once you are confident, once you clear these 4 modules, then you will start your clinical rotation where you will learn it next phase of your modules. Am I making it clear?
Yes, ma'am.
Yeah.
Yes, ma'am.
Yes, ma'am.
But after
Yes,
the
ma'am.
preclinical,
Yes, you can go ahead. Someone is asking some question.
yes, ma'am. After the preclinical training, we have 15 days of subspecialty
Yes.
training.
Yes.
And what is, tell something about this also.
Subspecialty, I think just now Deepak spoke about subspecialty. You are not there for the subspecialty. Just Deepak finished what happens in the subspecialty.
Yes, ma'am. We heard it, but can't understand properly.
Okay. Is it? I may know the name who has asked. This is just to.
Ma'am, myself, Tithi Haldar. I am from Poilan College of Management and Technology.
Okay. Subspecialty is mostly like to give you orientation towards, like I said, this preclinical training, I'm giving you orientation towards the what is required for a comprehensive, if a general patient comes to you. Not everyone will have the first month in a comprehensive clinic, right? So what would have happened is that for some of you, first month you may have get a contact lens posting. Some of you may get first month a low vision department posting, right? So if you are not aware of what to do in a contact lens department, okay, you don't know what to start, what to do, right? Just to give you an orientation towards what happens in the subspecialty clinics as well. Okay, so that is what is happens in the next 15 months. They're not going to train you in detail about everything, but they'll orient you what happens in every department. Like what happens in contact lens department, what happens in a low vision, what happens in a cornea department, because your rotations will be different, right? But you should all get oriented what happens in that department. So that orientation is what is happens in the subspecialty training. Is that clear now?
Yes, ma'am.
Yeah.
Yes, ma'am.
The purpose of preclinical training you is to give you not only the orientation, okay, to make you confident in doing these techniques. You'll practice it on each other every day. Every day you'll practice objective refraction. Every day you will practice slit lamp examination. These 4 modules you will be trained extensively in these 4 weeks, so that at the end of the 4 week, you all should have confident in doing all the given techniques, and there should be to the maximum extent uniformity in the way you does it. Okay, uniformity meaning some of the, like every college would have got a different ways of teaching you, right? Example, I'll tell you. Not everyone in LVPA, it is mandatory that we write it only in a minus cylinder form. All our prescriptions should go only in a minus cylinder, Spiro minus cylinder form. We don't accept in a plus cylinder form. Okay, some of you might have learned it only in a plus cylinder form. So while we are teaching you the objective refraction, or while we are teaching you the spectacle prescription writing, we will help you out how to write a minus cylinder prescription. And In here, it is always like I said, we record the visual acuity only in a feet notation. We don't record it in a metric notation, not we don't record it in a logmar notation. So some of you may not know, and what the charts we use is the logmar charts. Some of you might have gotten exposure only with the Snellen charts. Okay, you might have not gotten exposure with the logmar charts. So during the preclinical training, you will learn it how to record the visual acuity using a logmar chart. How do you record it in a metric notation? And when the patient cannot able to read from a 6 meters, how do you convert the distances? All those things you will learn it. And some of you would have not had enough experience of doing applanation tonometers. Okay, now we are going to teach you applanation tonometer so that when you start your clinical rotations, you can do applanation tonometry by yourself. So all these techniques, whichever I taught you, by the end of the 4 week, you should be confident in doing independently and as per the LVPI protocol. Is that clear now?
Yes,
Yes.
ma'am. Thanks.
Yes, ma'am.
For
Yes,
most
ma'am.
of okay, for most of you, it may be repetition. Yes, it is a repetition. Whatever the techniques you learned it in your first year, second year, third year only, you are going to learn it again. Yes, the purpose is that for you to make you a smooth transition to the clinics. Okay, we are again, you have gotten vacation, right? And because of the COVID, you might have missed some of the practical sessions. So to give you that, whatever you missed it, and the whatever, again to refresh you, okay, to make you bring it more confidence within yourself and to make you independently do all this technique, we are giving you 1 month of hands-on before you start your patient care observation. That is what is the purpose of the preclinical training. Again, I am saying this is the syllabus only for 1 month, not for your entire 13 months of your internship program. You do have a various, you learn many things after completing the preclinical training. This is the 4 modules is just for 1 month of your preclinical training. Okay?
Okay.
Yeah.
Yes, ma'am.
Yes. Yes.
Okay, ma'am.
Each of you will get a logbook. All the campuses will get a logbook. I think by Monday, the logbook should be ready. Everything, whatever you practice it on each other during the preclinical training, you need to document in a logbook. Okay, and this logbooks also carries a marks during your exit competency examination. Okay, and this whatever you document in the logbook will be similar to what documentation we does it in the EMR, so that again your transition will be smooth in terms of the documentation also. Okay, by Monday or Tuesday, every one of you will have logbook, and these logbooks are also same across the network. Okay, and like I said, at the end of the first month, once you are done with all this, that is after July 30, every one of you will undergo something called competency-based assessment rubrics. Okay, so what exactly this competency-based assessment rubrics is that, rather than having a score like you got 15 objective refraction, you got 30 in history, you got 20 in applanation tonometry, we don't give a numerical to the assessment. We give something called as a novice, beginner, advanced beginner, and competent for each technique. I just gave an example over here. So this is what is the lensometry. If a person performs 1, 2, 3, whatever I described here, these rubrics will be in detail explained again before we do your examination. Okay, don't worry about that. Okay, so once you perform 1, 2, 3 steps, you will be graded as novice. When you perform more 1, 2, 3, 4 steps, you'll be graded as beginner. So when you perform all it is required for a lensometry technique, you will be graded as competent. So for each technique, we have got a rubrics, okay, and you will be graded on a scale of novice to competent. Okay, and all the techniques will be assessed based on the objective structured clinical examination, that is OSCE. The advantage of having a OSCE again here is that not to have that. Earlier what we used to have is that we used to give them one patient and we used to ask them to do a complete workup on a patient. So what we have noticed is that for some of the students, there used to be a refractive error patient who comes as the subjects. For some of them, there used to be a cataract subjects, or there used to be keratoconus subjects who comes as the subjects, patients, like exam. So the difficulty level for a trainee to do a workup on a refractive error is relatively easy compared to a keratoconus patient, right? So now there is a difference in the weightage. If I have to do a patient who is a refractive error, it is relatively easy compared to doing a refraction on a keratoconus case. Okay, so in order to have a matching of the difficulty level for all the trainees, what we have started is we have started conducting even our examinations also on a OSCE pattern. That is to make the difficulty level and uniformity in the way we assess, okay, the students is also the same now. All of you will undergo the same level of difficulty level in doing the technique, be it a history, be it a refraction, be it a slit lamp, be it a applanation tonometry. Everyone will have the difficulty level will be the same in performing the technique. Even when you are doing the refraction exam, everyone will have a refractive errors within the defined range of whatever the measurement. For example, if we define that the refractive errors will be between 2 diopters to 6 diopters, everyone will get the refractive errors between 2 to 6 diopters. Not that one will get it 4 diopters, other gets a 20 diopters to refine it. No. So the range of difficulty is also now within the similar. Okay, so we are going to make, again, we will have one more session before you have your exam. The respective campus head will in detail brief you about how would be the examination pattern will happen. But to give you yes, this is what is going to happen. So don't worry about the examination pattern also. That is also standardized, and also the difficulty level is also at the equal part for everyone, again across the network. Not that GMRV will have, the trainees at GMRV, their examination is relatively easier compared to the people who are there at Hyderabad. No. So even the examination patterns across the networks is going to be the same, and it is going to happen in the similar way. Okay, with the same assessment methods. Okay, so that is using the OSCE structure. So what happens is that at the end of 1 month, you will have an exit competency exam. Okay, those who are at an advanced beginner or at a competent level, okay, they'll start their subspecialty training. But the trainees who are still at a novice or beginner level for any of the technique, okay, you will continue preclinical training for the 2nd month. And at the end of the 2nd month, again, you will have an exit competency exam. Okay. So keep that in mind, that only when you clear your exit competency exam from preclinical training, then only your next step starts. Until if you are not able to clear it, you will be continuing to do the preclinical training, because if you can't able to handle the primary fundamental techniques, okay, I don't think you will be able to do a justification when you start your subspecialty training. So that's the reason, only when you clear it out, you will start your subspecialty training. It's not that for 2 techniques you are at an advanced beginner and competent, but for other 2 techniques you are at a novice or beginner, still you continue preclinical training. For all the 4 modules which we assess you, you have to be at an advanced beginner or competent level to start your subspecialty training. If any of the module you are at a novice level, you again continue your preclinical training. I'm again making it very clear. You have to clear the 4 modules as an advanced beginner or competent. Then only you will start with your subspecialty training. If you are at a novice or beginner level for any of the module, you'll again continue with your preclinical training for the second month. You'll again have a exit competency exam at the end of the second month. Is that clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, okay. Yes. So this is what is the overview of the what is going to happen for the next 1 month time. That is starting from Monday, July 4th to July 30, 4 weeks. I think the respective campus heads, okay, Mr. Ram Kumar from GMRV, I think Ms. Garima from KVC, and Mr. Krishna Gopal from MTC campus, and myself who are at the Hyderabad campus, we will share you your schedules, okay, what it's going to happen from Monday. Okay, you'll start your preclinical training from Monday and it will go on till July 30. Okay, so on any given day, everyone will learn 2 techniques. Okay, so example, I'll take it from car camp who are at Hyderabad campus. So I think you all will be divided into 6 groups. So there are total around 110. You will be divided into 6 groups. So every group will have 16 to 18 in one group. So morning you will perform one technique and one faculty will be assigned to this 18 members who will be mentoring you throughout the technique. And in the post lunch, you will start another technique. Okay, again, there will be one more faculty who will be mentoring you while you are doing that technique. Okay, so on any given day, this applies even to the other campuses also. On any given day, you will practice 2 techniques. Okay, maybe in the morning, for example, you'll do lensometer. You'll start it from 9 o'clock till 12:30. You'll do a lensometer, you'll break for a lunch, and you will come back and you will start objective refraction. And you may start at 1:30 and it will go on till 5 o'clock. You will do a objective refraction. Second day, you will have 2 different techniques. So that's how the preclinical training happens. Okay, by the end of the 1 month, you will complete the full-fledged training on this 4 modules. Okay, and every day, whatever you practiced it, you have to only write down in your log books. Okay, I don't want it writing in any other notebook at all. It has to, everything, whatever you do it, that has to be documented in the logbook, because there is a weightage for the logbook also. Okay, and every day at the end of the day, you have to get it signed by the clinical mentor who is there with you. Okay, you have to show them how many techniques you have performed and get signed by the mentor. Is that clear? So Monday morning, every one of you will receive your clinical logbooks. Okay, and there is we will place the clinical schedule in the notice board. Okay, you can go through the clinical schedule. Your groups will be mentioned, which group you belong to, and you have to go to that respective group, to that respective lab, and the faculty will be there in the lab and you start practicing it. And Vijay has already shared you the list of instruments which you have to get it, right? Some of the instruments we will give you, like we will be giving you the trial boxes, okay? And we will give you the, I think, near visual acuity chart also being told to you to get your own, right? Trial frame, occluder, retinoscope.
No, ma'am. No, ma'am.
Okay, no problem. No problem. Whatever is being told to have it, to get you carry your own instruments, you get that instrument. Whichever it is required, rest we will give it as from our labs. Okay, trial box we will provide you. Don't worry about that. Okay, so but you have to get your own trial frame, retinoscope. Okay, so I think tomorrow morning is what is we have got a session where we will be checking your list of instrument what you have brought. Maybe initially 1 week time as a grace period we will give you. If any one of you still in the process of getting the instrument,